Great. Okay, I think we're started. Okay. Hi, everybody. Okay. Oh, perfect. Here we go. Okay. Hi, everybody. It's Dr. Dada, question and answer session. I've been out for the last week celebrating my 50th birthday birthday, so enough is enough. Time to get back to business. So I actually have a number of questions that people had asked me regarding gout, and they've piled up, so let's get right to it. I think so I'm just going to list the questions and then we'll go back in detail and discuss, right? So one question was what is drinking too much cherry juice? You know, drink cherry juice, yeah, what's too much? And the other one is that my doctor gave me allopurinol. Is it really safe for me to take that? Everybody's concerned about allopurinol and kidneys. And the other question was, well, what are the side effects of taking allopurinol, right? The other questions is, can your CRP levels be elevated when you are having a gout attack? And then the other question was, can you massage? Does massage help when you're having an attack? And it's not a bad question. So let's just take these questions one at a time. So my name is Dr. Arinola Dada. I help people dealing with gout pain get rid of the gout pain so they can just live active lives. So first question was about tart cherry juice. So as I've said before, the reason why people have gout is because their body's making uric acid, which is a normal process, but you can't get rid of it fast enough, right? So what tart cherry juice does is that it actually allows you to get rid of uric acid, and so tart cherry juice, or even just cherries, doesn't have to be tart actually, even just cherries have been found in studies to lower your uric acid levels, and they have something called anthocyanins, and those are, in addition to helping lowering the body's uric acid, they also have anti-inflammatory benefits, right? So how much tart cherry juice, that's the question, should one take? So there's studies. The one study that looked at people drinking 8 ounces, so that's 1 glass a day for a month, and they found that those people reduced their uric acid levels. But there are also studies that show using tart cherry juice in addition to medications that your doctor prescribes, such as allopurinol, would also work in sync. So just because you're taking tart cherry juice does not mean you should not listen to your doctor, right? So still listen to your doctor, but tart cherry juice has been proven. So answer to that specific question was 8 ounces. But if we kind of do a deep dive, cherries, right, 10 to 12 cherries a day have also been shown in studies to lower the uric acid levels. And there are also studies that show that if you just took cherries, you could lower your uric acid level by 10%, but you have to do it consistently. But taking cherries in addition to something like allopurinol lower the uric acid level by 75% compared to people who were just taking placebo. Okay, and then people wanted to know, one, my doctor wants me to take this medicine. So allopurinol is one of the standard medications that we use to treat patients with gout, and the question was, should I take it, right? So if your doctor says you should, there are a number of things that your doctor would look at. One is to make sure that your liver and kidneys are fine. If they're not, your doctor may have a conversation with you, right? If a person has impaired kidneys, so your kidneys are not working that well, the dose of allopurinol can actually be adjusted so that you can still tolerate the medication. The way allopurinol works is that it stops your body from making any more uric acid, so that eventually you start to excrete what you have, right? So that's kind of how allopurinol works. There are other medications like allopurinol called febuxostat or Uloric, and it's the same idea. They stop your body from making any more uric acid, and eventually you clear out what you have. Person wanted to know side effects of allopurinol. So most common side effects of allopurinol is a rash, and that rash can range from just a mild rash to kind of a more serious, severe rash. And so if you do develop a rash on allopurinol, just talk to your doctor, because your doctor may need to make some adjustments. So rash is common, diarrhea, nausea, as with most pills, that's possible. A lot of times your body just gets used to it anyway. It can cause some abnormalities on your blood count, and it can also cause some abnormalities on liver. The important thing is that you're in touch with your doctor. Your doctor knows that these side effects are possible, but monitors and kind of guards against it to make sure that that doesn't happen to you, right? Okay, and then the next question was CRP. So CRP is a C-reactive protein. It's one of those measures of inflammation, right? So the answer is yes. Can CRP levels be elevated if I'm having a gout attack, or do I need to worry about something else? So a gout attack means that you have these gout crystals there. Your body has identified that they do not belong there, and your body sets up this inflammatory response. It's the same response that your body sets up if it has an infection. Your body is there to fight enemies and invaders, and as far as it's concerned, uric acid doesn't belong where it was found, which is in the joint, and so it causes an acute attack. And so yes, the answer is yes. Your CRP can be elevated, your sedimentation rate can be elevated. But I think if it's persistently so, even after the gout attack is resolved, then you definitely need to talk to your doctor. But you were probably seeing your doctor anyway, and that's how it was identified that your CRP was high. Does it help to massage the areas, right? A good question, because if we think about, well, how does massage benefit musculoskeletal disorders? A lot of times if an area is swollen and inflamed, the muscles and tendons around that area get tight, right? So massage does help to loosen up the tension there, and if the tension was causing pain, then yes, massage will help. But if you recollect, people that have gout, they don't want you even touching that joint. It's like even the cover, the feel of the sheets is so painful that people don't even want you touching that joint. So that's why I kind of hesitate with the massage a little bit. There's so much inflammation and the skin is so sensitive. It's actually one of my tests, and that's how I know. And that's typically how I know that a person is having an attack of gout. Is it's so tender that you don't even want the sheets touching your feet. And then let's see. Oh, and then somebody wanted to know, can gout cause a trigger finger? So what's a trigger finger? Trigger finger is when your tendons get inflamed, and the tendons actually pass through like a tunnel of your hands, for instance, and so you flex and extend your tendons because they're like pulleys, and they go through a tunnel, and if your tendons get inflamed, then your fingers can get stuck, and when your fingers get stuck, it's called trigger finger. But if you have a gout crystals in there, then the gout crystals can inflame your tendons, and your tendons can get stuck. And so the answer to that question is, can a gout attack result in you having trigger finger? The answer is yes. So my name is Dr. Arinola Dada. I help people with gout get rid of the gout pain so they can live active lives. I am in the greater Seattle area. I work at Overlake Arthritis and Osteoporosis Center. We will take good care of you if you need our services. Take good care. Thank you for listening.